All right, now we're going to talk about non-disjunction. Non-disjunction is an abnormal division of genetic material, so abnormal division of chromosomes, right? So if you remember before, we have two forms of division. We have meiosis, which happens in our germ cells, so our sex cells, sperm and egg, and we have mitosis, which happens in all of our somatic cells, right? So everything else, non-germ cells, all right? Non-disjunction, majority of the cases, is affected by the abnormal meiotic divisions, right? So the best way usually people use this measurement is this technique called karyotyping. Karyotyping, or a chromosome map, is used to see if the child is prone to any kind of problems with non-disjunction, right? So a perfect example is when the baby is not born yet, right? It's an embryo and it becomes a fetus. Doctors grab a little bit of fluid, right, some certain kind of amniotic fluid, and they map it. They map it and they create this karyotype. The karyotype shows the 23 chromosome pairs, and based off of them, each section of the chromosome, you have to have 2 chromosomes, right? So instances of a phenomena called non-disjunction, you'll see an instance where we see this phenomena called trisomy. Trisomy 21. Right? So basically what they're looking at on a karyotype is whether or not that there's an abnormal number of chromosomes, right? So each pair at each station, 1 through 23, they have to have 2. If there is either more or less, that's an instance of non-disjunction. Trisomy 21, what's another name for this? Anybody know? Down syndrome, right? This is an example of non-disjunction. How so? Well, trisomy 21 is saying on chromosome pair number 21, you have 3 chromosomes. So this is an instance of non-disjunction. So the division didn't happen nicely, right? And so these people experience Down syndrome. So women, if a woman wants to get pregnant and she's always worried about the baby, women are very prone to, women's age is correlated to the actual prevalence of trisomy 21, right? So females, after the age of 35, their probability of experiencing a child with Down syndrome goes significantly higher, right? But again, based off of the statistic, it's not always guaranteed, right? So statistically speaking, they have a higher incidence of Down syndrome, patients with Down syndrome. Right. On the other hand, another condition that's regulated is we can look at any other. So for example, Turner syndrome. So Turner syndrome is a condition where there is a missing chromosome, specifically the sex chromosome. So these patients have a XO phenotype, O meaning blank, right? And so when we look at the actual sex chromosomes, right, so you have the sex chromosomes and autosomes, 22 autosomes, 22 pairs of autosomes, and 1 pair of sex chromosomes. When we look at the XY determining gender, these patients have just a 1X chromosome. And so these patients experience a lot of problems later on, when it comes to cardiovascular, neurological defects, but they are usually phenotypically female, right? However, because of this abnormality, they're infertile, right? And so these are 2 perfect examples of instances of non-disjunction. One where there's an excessive chromosome, and which is Down syndrome or trisomy 21, or Turner syndrome is an absence of 1 chromosome. So they're supposed to have either XY or XX, but it's X0, right? So this is an example of non-disjunction.